The effects of a suicide death ripple outward across the whole community. The emotional pain and the economic disruption, especially to families, can linger on for years. Younger kids who lose a parent to suicide may have a risk of depression and suicidal ideation that lasts a lifetime. We've got a suicide problem in the United States. Last year there were 44,000, in excess of 44,000 deaths. The actual total, probably higher, since some deaths are ambiguous. This is the equivalent of a small regional jetliner crashing every single day of the year. 20 seconds ago, we looked at the raw number of suicide deaths. The CDC thinks about this in epidemiological terms. They calculate the suicide rate as the number of deaths per 100,000 people. So the US rate has increased over time, and it is now at 13.4. The US average, though, doesn't tell the whole story. It's the distribution of suicide deaths and the death rates that's uneven. There's especially a hidden disparity between urban and rural areas. Urban areas have average rates just below 10. Rural areas have average rates of 18 or higher. This hits really close to home here in East Tennessee. The urban-rural community divide is very stark. While the Knox County average hovers around 15 for the rate, average rates in nearby counties are sharply higher, approaching 40 deaths per 100,000. Complex factors contribute to suicide deaths, but the strongest single predictor is untreated mental illness. Research consistently finds that rural areas have no access to psychiatrists and psychotherapists. Because treatment resources are concentrated in urban centers, a suicidal person might have to travel 90 minutes to get care. So is there anything we can do to bridge the gap? Since we know there are shortfalls in the system of care and they're going to take a long time to fix, specialists have been looking for other ways to close the gap between urban and rural suicide deaths, and they just may have found something that will make a difference. Social networks. Public health researchers analyzed the structure of social networks. They found a difference in the way that social networks are interconnected for people who live in big cities compared to the way that social networks work in rural communities. This difference could be a crucial key to reducing suicide in rural areas. Social networks in urban areas are plentiful, but they're diffused. It's less likely that if you live in a city that you'll share overlapping connections across your social networks. So I work with you over here, and I play tennis with you, and I see you at church. In rural communities, social network characteristics are that they are plentiful, but they are dense and densely interconnected. They have high rates of overlapping memberships. So I work with you, and your husband is my cousin, and we all go to church together, and we're on the same bowling league. Now hold that thought. In 1999, the suicide rate in Blount County spiked to 24 per 100,000. An all-volunteer group got together and they formed the Mental Health Awareness and Suicide Prevention Alliance. In the years that followed, they put out a lot of effort, but it was not clear that what they were doing was making a difference. In the summer of 2013, they decided to focus on effectiveness. Essentially, their idea was to figure out how could we harness the power of these densely interconnected social networks across the community and find a way to teach community members how to prevent suicide. After thinking things through, the Alliance created a realistic plan. They established 5 key conditions that had to be met in order to be successful. Then they set a bodacious, an audacious goal, but more about that in exactly 1 minute and 40 seconds. The first key was speed. They only considered programs that were compact enough to be delivered in an hour. Wrangling an invitation to speak in a community group was already hard enough. The invitation hinged on promising to conduct the training in about the same amount of time that it takes to eat lunch. The second criteria for success was the suicide prevention training program had to be really, really inexpensive. Did I mention that this group had a budget of 0? They held their monthly meetings in a borrowed space, and they didn't exactly own their own laptop. So after that requirement, the third requirement was that the training had to be easy to understand and to remember. Suicide is a difficult subject. The training material had to use non-technical language, and it had to offer clear guidance that the average person could imagine themselves using in a situation faced with a suicidal person. The group had another ironclad requirement. The program had to be evidence-based. Question, Persuade, Refer, or QPR, teaches you three things: how to spot the signs of suicide, how to ask a person, are you thinking of killing yourself, and what to do if the answer to that question is yes. The final key to success was diversity. They intentionally sought out a wide mix of audiences. The Blount County group accomplished this by tapping into their own interconnected social networks. And so they trained Rotary clubs, police chaplains, nurses, teachers, firefighters. In 2014, 5 QPR instructors fanned out across the community. They passed around a borrowed laptop, trained people in church basements and community centers. That audacious goal I told you about a minute ago, and a minute and 40 seconds ago, by the end of 2016, they had trained 3,001 people on how to prevent suicide. So an exploratory study has already been completed on this prevention program. There's an opportunity now for a much more rigorously designed piece of research. The evidence could allow this low-cost, volunteer-led prevention program to serve as a template for saving lives throughout East Tennessee and across our country.